accessing mental health care and why it's so important, not just in today's climate, but why this is a real issue that existed pre-COVID and will exist infinitely into the future. So I want to kind of set the stage, first of all, and just talk about the crisis that we're in. It is hard to not go a day seeing newspaper headlines right now, bringing attention to how bad it's become. Upwards of 1/3 of adults in the US are reporting issues with anxiety. That number is almost equal for adults reporting issues with depression. Even therapists are really calling mercy right now. So they are exhausted, they're overworked, they're burnt out, and they're going through grappling with the same uncertainty that the rest of us are. So when we think back on the year 2020 and all of the chaos that we've seen, we are going to actually think back and say this was the first time that majority of Americans really became aware of how acute the mental health crisis is. I am going to take you back pre-COVID because this is not just a temporal and passing issue that we can forget about once the pandemic reaches its conclusion. No, pre-COVID, this was a massive issue. Adults were reporting loneliness issues worse than ever before. The vast majority of adults in the US were reporting feeling stressed. So what can we say about the mental health system and really how equipped it is to handle issues like this? So one, we have a massive mental health care provider shortage. The numbers are staggering when you think about a country of 300 some million people. We've got just 100,000 licensed psychologists. We've got just 40,000 licensed psychiatrists. Rural communities are left out of the equation altogether, as are racial minorities. So if you look at these numbers and envision sort of the minute access that exists and how much we've now come to realize that systemic racism and racial microaggressions are mental health issues, the void that exists is enormous. Cost. We all know cost is a barrier, but what happens is that massive provider shortage actually drives up the cost. And as much effort has been brought to bringing mental health parity to the fore in the insurance industry, the reality is that supplier shortage doesn't make for parity. It's not possible. So 60% of people who do seek mental health care today are actually paying out of pocket, regardless of whether they're on a Cadillac level health insurance plan. That is just the reality. Now, we can't talk about mental health without talking about stigma. Of course, huge advances have been made in terms of talking about mental health, especially this year. But for those who have employer-based coverage, the fear still exists that talking about mental health affects them professionally. What will my manager think of me? Will I not get promoted? Will I lose my job over this? So these are the three big issues that really dampen access to mental health care. There's actually one more that we at Supportive have observed. And that is that there is this tendency or growing trend in the US for people to distrust experts. 51% of Americans have some distrust for doctors. And if you think about political trends in the US, you can see where this is going. There is a rejection of intellectualism. People don't want to be analyzed. They don't want experts diagnosing them. So this is a number from Psychology Today's survey asking why people don't go to therapy. And they're saying that I would rather talk to my friends. Now here's the big issue though, is that we no longer as a society live in a world where we have these close confidence that we used to have among neighbors, among our community. The most common response in this annual and biannual US general survey of millions of people is that people don't actually have close confidence that they can spill their mental health struggles with. And that has largely to do with us living in a social media world. So we are constantly presenting and projecting the best version of ourselves onto social media. You think about during the pandemic and how many of us are posting about baking banana bread and the cool things we're doing to pass the time. We're building forts inside. That's not a reflection of how we're feeling. We need an antidote for these issues. Now, I'm here today as the co-founder and CEO of Supportive, which is a digital peer-to-peer support network. So obviously, I'm going to talk about that as being a key part of the solution. But I do also want to step back and talk about what else there is, because if we're going to talk about broadening access, it's got to be about solutions that are easy, that are simplistic, and that are low to no cost. So I want to kind of run through some of them. One, meditation. This has been a huge burgeoning trend the past couple of years. It's now a couple $1 billion industry. Meditation has a lot of benefits. You don't need fancy equipment. You can plug in earphones to your phone and go. You actually don't need equipment at all. Once you master the concept, you can still and quiet your mind, any time of day. Now, here's the challenge. Is that meditation is incredibly effective in increasing your tolerance to stress. It's about resilience building. But what it's not addressing is that source of stress. Whatever it is that has caused you this emotional distress isn't actually going away. Two, I want to talk about nature. Nature walks have long been prescribed by doctors as, the antidote to depression and anxiety in Europe and Asia. Japan has a whole concept of forest bathing that we can learn a lot from. It's actually as little as 10 minutes a day will reduce stress and anxiety in your body. Exposure to nature actually sort of works on the part of your brain that activates during rumination, which is the human tendency to cycle around negative thoughts. It doesn't even have to be sort of, rural or suburban nature. This can happen in urban environments. It's really about exposure to trees, funnily enough. I want to talk about volunteering. So this is something that I firmly believe could be, a nationwide societal solution on the horizon. So 87% of people who volunteer report that it reduces their stress levels. It has been shown through numerous studies to impact anxiety levels, depression levels, and anger, which is incredibly important in today's political climate. 96% of people who volunteer say that it gives them an increased sense of purpose in life, which is a major way to combat depression and hopelessness. And then we got to talk about apps. So apps, are they the panacea? Are they a solution? At last count, this is an incredible number, but CNBC came out a couple weeks ago saying that there are now 20,000 apps in the mental health realm on the app stores. And my fundamental issue with most of them is that they are catering to the same elite, coastal elites who would normally engage in mental health care anyway. A lot of them are about channeling people to therapists through apps. And to me, that is not broadening access. That is just shifting the convenience aspect of mental health. They are about journaling. They are about, sort of logging your thoughts and logging your emotional changes throughout the day. There's an infinite number. The cost ranges from anything in traditional mental health care, $300 a month to, $20 a month for a journaling app. I think that the fundamental dividing line here is, are these apps isolating individuals? Such as like robot therapists. I mean, sure, these are cost effective, but is that really the world that we want to live in, where we are further withdrawing from human connection and actually believing that we need to talk to a chatbot in order to get some solace? Or are the apps fostering human connection, which is what people really need the most? That's what we're missing in today's world, not just during the pandemic, but in this entire decade of social media driven communication. So with that sense of, you know, how do we want to see the future? You know, my co-founder and I began looking at, you know, what aspects of mental health are underutilized, what could be tapped and actually be a large mass market population health level solution. And it's peer support. So peer support has been found in hundreds of studies to be as effective as traditional modalities of care, like cognitive behavioral therapy, as effective even as medication, so antidepressants. There are a plethora of studies. The challenge has really been, how do you elevate this above like one-on-one connections? Because what was so special about peer support, if you think to you know, models you may have heard of where grief support or Alcohol Anonymous, is that people have a shared lived experience that they're able to validate in one another and have that instant sense of understanding among one another. So that's where supportive comes into the picture. We've created this digital concept of small group, dynamic forming peer micro communities where you're matched with people who are going through the same struggle as you. You feel that sense of understanding and you feel a sense of purpose because sharing your struggle is helping someone else. We've taken that a step further and we're actually connecting people in real time as they talk through language analysis to the exact right resources, including articles, videos, podcasts that are going to help them address their mental health needs. So just a little bit more about the approach that we're taking. We firmly believe that mental health is not limited to illnesses or conditions. Daily life struggles affect us all. And we see this poignantly in 2020 with the struggles that parents are facing. You know, we have sort of emotional feelings about this 24/7, you know, close quarter, you know, demands of the role. People feel existential worries about where this world is headed. What is the political climate going to, how is that going to impact me and people I care about? We look at relationship conflicts. We look at emotions like anger and jealousy that people don't traditionally think of as something that you need to go see a mental health specialist for, but we believe that it's all encompassing. Supportive boils everything down to one question. We ask people, what's your struggle? And we now have millions of data points that enable us to get to precision matching. So what that looks like on the platform is that these little tiny dynamic micro communities form. Those pictures represent our moderators. So we have human moderators at the center who are keeping everything safe, troll-free. We're able to route users who may be in crisis to resources that are, you know, more at the moment for them. And so when people come in and they explain, it can be one word or a paragraph about what their crisis is, we're actually pinging the platform and saying, are there people live on here right now concurrently that we can match you with to have a discussion about this? And if yes, we're routing them in under 30 seconds into a live discussion group. And if not, we're actually opening a group for them. So it's a user and a moderator until other users join. I just mentioned sort of the object of dropping resources in, but we're taking a much broader look at this. We're actually looking at the entire world of self-help resources that exist. What are the 49 other types of therapy besides the cognitive behavioral therapy you'll find in thousands of apps? What are the best, you know, research studies that have come out that show impactful modalities that are going to help individuals, and how do we match those in a very palatable kind of spoon-fed way to individuals in the moment that they need it? We're operating all of this 24/7. We've got a global network of moderators all over the world that get pings on their mobile phones to say, hey, we need a moderator, you can jump in. It's a paid position, but there's no shifts. So it's completely at will. And we're using the moderators training to actually operate a two-sided platform. So the users see a seamless experience that's just like a chat among these new little community that we form for them, to talk about their struggles and actually get that feeling off your chest, get some solution. The moderators have special features, and all of those features that they're able to take advantage of are powered by this incredibly powerful language corpus that we've developed. That's really the backbone of the whole solution, and why we're able to operate using natural language only. So I think that's a great little overview of Supportive. We've been in market for a little over 2 years. We're up to 600,000 users. 1.7 million people currently can access Supportive as a free health benefit. And actually early next year, that number is going to jump to 10 million. We're, like I said, operating 24/7, 365 with less than a minute wait time. We've lowered the cost of mental health care by 10x or more compared to traditional modalities. And we're actually already delivering clinical grade outcomes, even though we are a mass market solution. So that's our vision. Whatever time of day, whatever struggle you have, you should be able to connect with peers, and you should never have to struggle alone.
Really, really interesting. So well presented. Thank you very much. We do have to wrap, but that was a very thorough and very compelling explanation. One thing you didn't say is that Walmart's employees in the United States, for example, get access to your service. Anybody can go there anytime. You group people according to the people you have available at the time, and the moderators themselves are trained for the most part. Is that right?
That is correct. So our moderators are subclinical. We actually use psychology students in many cases, but they go through an extensive training course that was developed by clinical psychologists at Stanford. They are trained internally with scenarios and testing, and then actually they get continual skill building even while they're on the platform.
Fantastic. Well, thank you so much. Really great presentation.